Good evening, everybody, and happy holidays, and also happy Hanukkah to those who celebrate. I'm Dr. Elkin, the medical advocate, and I welcome you tonight on YouTube Live. Tonight, we're going to focus on my book, From Both Sides of the Table When Doctor Becomes Patient, How You Can Become Your Own Medical Advocate. And it's been a year since it was launched. And I think this is a great time just during holiday season to really see what's happened in that year and how useful this book can really be. Now, I just want you to know that the year is always full of new advances in medications and treatments and so forth. But what's happening in the realm of functional medicine? Therefore, many of us have interest today. And just to reiterate, let me tell you the contrast. So, in traditional medicine, we have symptoms and then we have treatment. Okay. Now, in functional medicine, we have symptoms, we look for the cause, and then we actually have treatment. So there's a difference in approach. So in functional medicine, we actually try to find the the cause because there's no cookie cutter approach in medicine. And that's what my book talks about. What I think what a lot of us are looking for today in the world of medicine. And did you know that the average doctor spends on the average of 5 to 7 minutes in the room with the patient? 5 to 7 minutes. And do you call that adequate? Do you feel heard? And many people don't. And that has been a complaint with patients from many years over with surveys that patients do not feel heard. And that's what really needs to be changed. And that's one of the purposes of my book. And please excuse me, I'm dealing with the cold right now, so my voice is not normal. So please apologize for that. Just keep with me if you can. Okay, so let's talk about the book. There are five components of the book. Number one is my story. Number two is the medical, and I'll explain all this in a minute. Number three is becoming your own medical advocate. It's really about you. I just use myself as an example. Number four is the how-to part. How do you actually become a medical advocate? And number five is the setback, the obstacle, meaning the part I call that the book without an outline, because that was the unplanned part. Okay, well, I'm not going to recap in detail what my book is about. I think many of you know this already, but basically, I was hospitalized twice in the span of 19 months. The first time, it was actually a very small but definite heart attack. Here's a cardiologist with no known risk factors being admitted to Cedars-Sinai Hospital with a heart attack. And yes, I ignored my symptoms for several. I didn't ignore them. I just didn't. I downplayed them. I didn't really think this could happen to me. I was like your typical male. And if you want to learn how I got to the emergency room on that fateful Thursday, you have to read my book. Let's just say it was quite an experience. And I learned while being hospitalized that you really have to take the bull by the horns and be your own medical advocate because when I was being discharged, the doctor, the cardiologist, who's probably 15 years younger than me and about 50 pounds heavier, and it wasn't muscle, said, Dr. Elkin, I don't know what to tell you because when it comes to rehab, you're on your own. I said, okay. Because I have never been, nor will I ever be in your kind of shape. I said, I can take that. He said, but you know what? You're going to do just great because you have this new stent and everything's going to be great. So he leaves me and I said, I have this great new stent. Well, everything is going to be great. Then why did this happen in the first place? And more importantly, how can I prevent a recurrence? And that became my mission from that point on. Fast forward 19 months later, I'm being readmitted to Cedars-Sinai, this time with emergency, with horrible back pain. I knew I had a back issue since 1996. Now it was already 2008. Spent all these years with relapses and remissions. But this time it caught up with me and I couldn't walk. And I was fit to be tied. Anyway, I was admitted and I had emergency back surgery. And the back surgery was extremely complicated. It was marred by permanent nerve damage. I had a drop foot on the right, and I couldn't walk. The first 3 days in rehab, all I could do was go from sitting to standing with a walker. That was it. I was badly broken, badly broken. And to make matters worse, not only was it marred by permanent nerve damage. It was also incomplete. So over a period of years, the disease would turn. So that was my experiences. So the first part of the book is really about my story, um, and what I had to endure to evolve to the role of medical advocate. For example, I'll give you one example. I was going to be the discharge planner came to me. He said, "Doctor, I don't know what to tell you, but your insurance won't allow you to go to the rehab." I said, "What do you mean?" They say you need to go to a nursing home. I said, "Nursing home?" Now I was relatively young at the time, or 15 to about 17 years younger than I am now. And I was insistent that you got to be kidding me. So here I am on opiates, in pain, in bed. And I get on that phone. I spent 3 hours with Aetna PPO, convincing them, demanding that I be brought to rehab, that I'm not going to a nursing home. I did it with no help from the hospital. So if you think doctors get special privileges, you're wrong. I did it all on my own because I was like a pit bull. And this is what you have to do. You have to step up to the plate if you want to be your own medical advocate. And that's how I learned. So that was hospitalization number 2. The medical part is the second part of the book. And even though everybody knows about cardiac risk factors, they don't always look at it the way I look at it. So there's 5 major risk factors, which we're not going to talk about in detail. Number 1 is hypertension. Number 2 is smoking. Number 3 is the cholesterol issue. Number 4 is diabetes. Number 5 is obesity. Actually, there's 6. And number 6 is physical inactivity or lack of exercise. Excuse me, all of which are important. Um, I make a big deal about the cholesterol issue because, excuse me, there are many people today um, on social media that want to that want to make you think that cholesterol is not the issue. It's not important. It's not really a cause of heart disease, and I beg to differ. I'm very out of the box. Um, but when it comes to people that have known heart disease, like me, statins are very important. And cholesterol, LDL cholesterol is an important issue. Just thought I'd bring that up. Then I talk about the secondary risk factors, which include things like um, LP little a, that's a fragment of LDL, uh, inflammation, elevated C reactive protein, periodontal disease, inflammatory markers, genetic markers, environmental pollution. There's a whole list. And it's all in my book. So we don't need to repeat that here. Now, when we get to the third part of the book, that's about how you can become your own medical advocate. And I start off with a pep talk because I think pep talks are really relevant today. And number 1 is embrace the power you have. Darn it, embrace the power because no one knows your body better than you. I don't care who they are. I don't care how many diplomas they have on their wall. No one knows their body better than you. So speak up and let the doctors know what you're feeling, what you're experiencing. Trust yourself. So important. And this is where physicians fall short because we don't really listen. Get a couple of ideas and then we take off. We already know what's best for you, or so we think. And that's where you have to prove us wrong. Do not feel compelled to make hasty decisions. I mean, learn your options, do your research, go on the internet, get a second opinion. Most medical conditions are not of an acute emergency nature, like mine was. One was a heart attack, one was emergency back surgery, and acute appendicitis is another one. But most of the situations we see, cancer or, you know, autoimmune disorders, these all are of a chronic nature. So you have time to do your research and make yourself known. Do your part. And the third thing I want to mention is know your body. I mean, I was anything but. I was totally clueless. I had pain. I had discomfort for, I think, 14 hours before I checked myself into Cedars-Sinai. That's crazy. Here I am, a cardiologist, and I didn't know my own body well enough to say, I'm having a heart attack. You don't have to make my mistakes. Trust your instincts. You know, I believe in patient smarts, so why don't you? You know, I learned a lot. So it's all about stay in the driver's seat as it relates to your health. That's really what I say. Um, Now, by the time you get to this part of the book, you're kind of saying, well, of course he figured it out. He's a doctor. Not so. Okay, most doctors don't really take the time to look at themselves the way I was forced to, or the way I was compelled to. So I have one chapter in my book called My Heroes, and I interviewed about 8 people that were not medically trained, that did not have a medical background, but they did the research. They knew their bodies. They, I didn't necessarily agree with what they did all the times, but I respected what they did and how they did it. And I think it really played a role in how I think it played a role in how they did. It's really important. So don't think you have to be a doctor to be able to do this. That's not true at all. And also, I included a chapter on my dream team. Don't think you have to do it alone. Okay. Who was my dream team? Well, I had my regular doctor. I had physical therapist. I had chiropractor and nutritionist. I had a body worker. I had 5 people, and I added a 6th one later. And these are people that helped me from my broken situation after my back surgery. And I depended on them. We worked together. I did the work, but they were there behind me. It was so important. So don't think you have to do it alone, because you don't. You just to take the work, take the other people's help. So then we go to the next part of the book, the how-to part of the book. This is really what is in there for you, the audience. And I preface it by talking about a patient's bill of rights and a patient's responsibilities. And this was not new. I knew from the beginning of this century that I wanted to write a book. I even had a name for it. It was called Reclaiming the Soul of Medicine. I mean, I didn't know what functional medicine was. There was no term back then. But I knew that there was something that needed to be done that was a change, because it wasn't looking good how medicine was practiced. This is 2001, guys. So I had this name, and I came up with these patient bill of rights and pay responsibilities, and they still stick with me today. Although, I'm a lot further along the pike. I had to literally be hospitalized to write this book and to be in the position I am today. So, what is a bill of rights? And I made this up. Number one, the right of individuality. You're an individual. We are individuals. Medicine wants to think you're not. Medicine wants to use a cookie cutter approach. I'm sure you've seen this. When I was in the hospital a few years ago, I got stopped by a nurse after I wrote the discharge orders on a patient who was in heart failure. Patient was stable. We were getting ready to discharge the patient. And the nurse says, Dr. Elkin, did you forget to add a beta blocker or a calcium blocker or, I don't know, some medicine to Dr. Mr. Jones' drug list? I said, no, I didn't forget. I didn't write it. Why? Because I didn't think it was necessary or warranted. Well, it's going to fall out of compliance because the clinical pathway expects for you to be able to do that. I said, no, I'm not going to do that. Well, then you have to write a reason why. I had to go back to the chart and write why I thought it was not necessary for this patient to go on a beta blocker or a calcium antagonist, whatever it was. I mean, I was being questioned because I was going to fall out of compliance because I didn't fit the mold. I didn't fit the cookie cutter approach. So, right of individuality is important for every one of us. Right of choice. Yeah, you want your doctor to have knowledge and experience, but does he or she have empathy? Do they have listening skills? I have people in my own family. I love them. My siblings. They're not empathic. They're not like me. I don't know why I'm different. I'm the empathic one. Doesn't make me better, but it's what I look for in my friendships. It's what I look for in doctors and providers, people that can understand the pain I'm going through, because they can't help me. It no longer becomes the right of individuality. So listening skills and empathy is so important. And the right of encouragement. Yeah, you want to be able to, sure, I'm in touch with mainstream medicine. I mean, I just came back from a 2-day conference at Cedar Sinai at Beverly Hills Hotel on current concepts and controversies in cardiology, because I want to and I need to keep up with the latest and greatest. But then I also have to continually exercise my right as a functional medicine practitioner to look outside the box and to treat the patient as an individual. And you also have the right to be heard. Now, I'm going to tell you something. This just happened today. I had a couple that took 2 buses to come to me from South Central LA. pay cash because they wanted to be heard. Their HMO doctor was going to put them on medication. This gentleman has had lots of problems with dizziness with various medications. So they come all the way to see me. They schlep on 2 buses because I'm going to sit down and talk to them and listen to them, and they're going to be heard. And what do we come up with? Let's try the next 3 months to lose some weight. If you could lose 15 pounds over the next 3, 4 months, you may be able to get off medication completely. You know what the doctor told them? That won't happen. You'll never lose the weight. It's not going to help your blood pressure. You see what I'm saying? It's being empathic, and it's being able to listen to the patient, they get heard. It's really important. But patients also have responsibilities. Okay, it's not a free lunch. And when it's persistence, you're going to get some frustration along the way. Your average doctor ain't like me. They're not going to just be able to, look at all your supplements. I mean, I have patients that come in with a bag of supplements. And I'm saying, whoa, you must have expensive urine because I don't know how anybody can absorb all that. I'm talking about a shopping bag or 2 of supplements. I said, does your primary care doctor know that you're taking all this? Oh, no. If he knew that, he'd fire me. I said, he'd fire you? Who's paying who here? It makes no sense. Um, so you're going to have to be persistent, guys. Not every doctor is going to be as free-spirited as me. You have to let them know what you need, what you want. This is a patient-driven society, damn it. So make sure you're heard. Self-education. You have to do your work. You got to do your homework. Get on the internet. Read your books. Listen to programs such as this. Okay, I'm not the only one. And the other one is assuming financial responsibility. I can tell you now, a lot of the tests and functional medicine are not being covered by insurance. Yeah, it'd be nice if they are, but saving money and being proactive in your health is not what this country's all about. We are into sick care, not well care. So if you want to be well and not sick, you're going to have to dish out some money because that's just not going to happen with Medicare or PPO insurance. So those are your responsibilities. With that, we talk about the other components. I talk about the 5 dimensions of wellness. Now, I came up with this many, many years ago. So number 1 is physical well-being. Number 2 is mental well-being, which is memory. Number 3 is emotional well-being. Number 4 is spiritual well-being. And I stopped with that because I like quadrants, right? And my daughter, about a year later, my oldest daughter said, Dad, you forgot something. I said, what? You forgot social well-being. I said, come on, that screws up the whole thing. Now I got to think of another, you can't use quadrants anymore. But I thought about what she said, and she made sense because we don't live in a bubble. And if we haven't learned anything from COVID, we learned how unhealthy it was to be isolated from others. It wasn't a good thing. It was not a good time. And I saw it in numerous patients. I really did. So people who need people are the luckiest people in the world. So I think it's very important to remember that social well-being. And then after we embrace all those, we now ready to go into the meat of the book, which is number 1, nutrition. That's my meatiest chapter, pun intended, and it's entitled You Are What You Eat. And I discuss every diet pretty much that you've heard about, the pros and cons. And by the way, I'm not into one single diet because, again, that's very individually driven. Number 2, supplementation. Why supplement? There are still people in mainstream medicine that believe you get all the nutrients you need from food. Really? Seriously? Has anybody examined the soil today? Okay, when I was into nutrition in the 90s, we had this thing called, the number 5. You should have 5 fruits and vegetables today. That has now ballooned to 15. 15 fruits and vegetables a day to get adequate nutrition. I don't know about you, but I can't eat 15 fruits and vegetables a day. So if I didn't supplement, I'd be not healthy at all. So I talk about various supplements, and I talk about 5 supplements that I think are very important for the age of 40 and up, which we can discuss. But actually, It's a whole YouTube program in itself. Number three is you got to move. You have to exercise. I talk about both cardio, aerobic exercise, and also weight training. And I've already mentioned to you that weight training is essential, especially after the age 55. If you only have time for one type of training, it better be weight training because muscle is your organ of longevity. And the next chapter is this component is you got to breathe. It's about breathing, um, relaxing, and meditating. It's the name of a meditation practice. And the last chapter of this part about becoming a medical advocate is how to do anything but age ungracefully ever after. We talk about hormones, nutrition, other things, and you can read about that in my book. It's my component on anti-aging, not exhaustive by any stretch, but kind of where I fit everything in. So that's what I thought was going to be my book until I was hit with a relapse on May 5th, 2015. And I was involved with a cancer walk for my partner. And the next day I couldn't walk. I didn't have pain, but I couldn't walk. I couldn't flex. Or, my right foot already had permanent nerve damage. It became worse. Make a long story short, I had a relapse. My marketing fellow said, "That's great for marketing." I said, "What? That a relapse?" No, he said, "The purpose is that the thing here that you're trying to emphasize is that life is really hunky-dory, but then get hit with an obstacle like we all do, and you gotta regroup." And that's what I did. So I wrote that last part of my book. It's called the story without an outline because I didn't have an outline for that part. It was just based on I wrote extemporaneously, and I wrote in the first person. It's if I was really writing a journal to myself. So that was my book. I think the relevance is as good today, if not more so than a year ago, because things aren't looking good. I mean, right now we have 35 million diabetics in this country. Okay, that's 11.1% of the population. By the year 2050, that's supposed to be 55 million. Okay, that's like not good. Over half the country is hypertensive. Less than 10% of the nation's population is metabolically healthy. We are not looking good as a nation. And if you look at longevity, we're like number 32 in the list, which means 32 other countries do better than us with regard to lifespan. Yet we spend more on healthcare than any other country in the last 2 years of life. Does that make any sense? So thank you for your attention. So I'll take some questions. So this is really a recap and also to re-illustrate the relevance of my work and my book, and hope that you haven't read it, you will read it. And if you have read it, I invite you and beg of you to please go back to my Amazon site and write a review because reviews are really important if you're trying to make it in this world as an author. And I already have an idea for my next book, but I'll tell you about that another time. So now I'll take questions. I don't know speaking right now. Okay, guys. Okay. What are the best ways when speaking to your physician to communicate your concerns to your medical advocate that may help other doctors take action? That's a great question. Um, See, it came natural to me. I don't, it just came natural to me because I care about people. I think it comes across that way. I really do care, and I want that we. I think doctors are good people. We want to help people. That's why we're in this profession. But you get caught up in the system. And the system is do this test, do that test, and and don't never give up. Just keep on testing or keep on trying this med or that med. In the last 2 months, 3 months, I helped two people die. That was my job as a doctor. I got them out of the hospital, at home with their family, and had them spend their last few days at home and get out of the hospital. And I think it was one of the most endearing things I've ever done. Now I'm helping people to die. But you know what? That's part of death isn't such an ugly thing. It's part of life. We all have an expiration date. And so And that's probably what I'm going to write about in my next book. And of course, I've experienced it with the loss of my own partner a year ago. But what makes me different? I don't know. I've always been this way. I'm inquisitive. I'm curious, and I want to help. And I'm just patient with people. I mean, some people could drive me ragged, but it's just who I am. I don't know if you can teach someone to be empathic. I don't think you can. I have people in my family that will never be empathic. They have never been empathic. I used to think they were empathic, but they aren't. And I've given up on trying to change them because I can't. I accept them for who they are. I love them, but they aren't people I would necessarily hang out with. You have to do the same. You have to, get opinions find out who your patients, find out who your friends or family members are that are seeing doctors that think outside the box. They do exist. I'm not the only one, I promise. But, again, that's part of the research. Try to find someone that you can deal with. And then you meet with them and you have your notes in front of you and you come in there looking like you know what you're talking about and voice your concerns. If they're looking at their watch or if they're typing at their computer, if they aren't really attentive, that's not the right doctor for you. You'll know. And yeah, it could be a laborious process, but you got to keep going till you find what you want. Hope that helps. Um, why don't all doctors use a Cleveland blood lab? Here's why. Because your insurance doesn't want you to do this. Okay, I kid you not, that I have been almost dropped. I'm now being dropped from Anthem Blue Cross because I ordered too many Cleveland blood labs. I have tried to explain to them that I'm a functional medicine, integrative cardiologist practicing functional medicine. And I do this to help the patient. They don't give a damn. They don't. First of all, you could be with Anthem this week, and next you could be with Medicare or some other insurance. They don't care. They're not into your health. They're into the almighty dollar. And if I can't use a cookie cutter to get you to so it's that simple. They don't like sophisticated testing. And that's why so many functional medicine testing today is going to cash only because it's so much BS for insurance to cover it. It's really gotten bad. And I see I'm so sorry this happened, but this is really, it's happening more and more now. Okay, good questions. I need more. Anybody else? Well, who out there read the book and liked it? I'd like to hear that. It's just tea. It helped me get through this evening. Okay. Okay. We're good. Good old boy. Thank you, Will Brenner. I love the book. Thank you. Thank you so much. I appreciate it. I had fun with it. By the way, it was a 10-year project. Doing the research, everything, but I wouldn't trade it for the world. What numbers should we worry about with blood pressure? Good question. Um, Here's the thing, and the numbers have changed. The last major revision was done, I believe, in 2017. So really, if the systolic blood pressure, the higher one, should be less than 130, and the diastolic or the lower one should be less than 80. So that means if you have 131 over 81, you're hypertensive. Now, when I was a student, that was even considered borderline. Now, is that just some right-wing plot to make us be on more medication? Not really. There is some science behind it. We have found over the years that those that remain a lower blood pressure throughout middle age and beyond actually have less heart disease, less strokes, less kidney problems, and like this one more, less dementia. So we have found that hypertension in midlife portends higher increased incidence of dementia. I think one of the biggest things in functional health right now, medicine, is to really look at mental health, which is why that second dimension is mental well-being, because we can do something about it. Even if you have the ApoE genotype, which puts you at risk of Alzheimer's, you don't have to fall privy to it. There are things you can do with diet and exercise, and in this case, blood pressure. So we don't just let's wait for Alzheimer's to happen. I'm not in that school. The people that I look up to is Dr. David Perlmutter and Dr. Dale Bresnan, and they're your functional neurologists, like I'm a functional cardiologist, and they believe Alzheimer's can be reversed and even prevented. So don't let genes tell you what to do. Okay. Can quercetin hurt? Quercetin, no, quercetin's great. Quercetin is an anti-inflammatory supplement. I use it in my ImunoWise, okay, which is the product I came out with during the pandemic. I saw that 2 weeks into the pandemic, we didn't have what do you call it, vaccines in. But this is what the government was telling us to do: wear a mask, wash your hands, and socially distance yourself. Now, we did that because we were scared and we didn't have much of an option. We didn't know any better. But I said, something's wrong with this picture. What are we telling the public to do that can be helpful? Like, if you have an intact immune system, you're less likely to die from COVID. Or if you get it, you have a lesser course of it. So I put together my product, which has 5 different components. It's called ImunoWise, and one of which is quercetin. But even Dr. Fauci, it took him 10 months, if I remember correctly, till he came to the forefront and said, yeah, vitamin D is kind of important. Like, are you kidding me? I've been saying this forever. So we can't depend on mainstream medicine and mainstream government to keep us healthy. That's why the book is so important, because, as I said before, I know I'm talking like a salesman now, and I don't mean to be. But I mean, this is an inside job, guys. If we don't do it, no one is. I mean, I think we all want to make a better world, but that's a daunting task, especially with what you see going on right now, especially at getting into election season. But what we can change is ourselves, and little by little, I think we can make the world a better place. I am ultimately an optimist, and this is what I try to do. So it's an inside job. That's why I will talk to as many people as I can and sound like a preacher about this book, because I'm so passionate about it. I'm so passionate about patient smarts and what you can do, what we can do to preserve our health and well-being. And yeah, I had some stuff happen to me that wasn't pleasant, and I'm still having it. I had a very rough year, starting with the death of my partner, but doesn't make me stop. I keep going. And that's what we have to do. So pardon my preaching. Okay, can young kids about 10 years old? Vitamin A is good for the immune system. Yeah. You don't want to overdo the vitamin A, especially in young kids. Any fat soluble vitamin can be stored in your fat cells. So, so what are the fat soluble vitamins? Vitamin A, vitamin D, vitamin E, and vitamin K. Water soluble vitamins like B vitamins and vitamin C, you can take whatever you want, because they're basically, well, not whatever you want, but they're water soluble, so you'll basically pee out what you don't need. But vitamin A is good for children because it helps build the immune system, but I wouldn't go overboard on it. Okay, let's see that I see anything. Thank you for these comments. Okay. All right. Well, I see. I think I've taken enough of your time. One thing I want to say, that if any of you guys have other topics you want me to talk about, I thought about leaving a mention here, but actually, the best way to do it, if you don't mind, is to send an email to my front desk. So it's ADMIN. That's short for administration. ADMIN at heartwise.com. Again, ADMIN at heartwise.com. Adela will answer and just say, I'm interested in the doctor discussing these in the next few months on YouTube, because I'm only as good as if I do the things that you're interested in. I do what I'm interested in, but I want to do what you're interested in. So I need the feedback. And I don't always get a chance to go back to YouTube. I don't have the staffing to do it for me. So anyway, um, just ADMAN at heartwise.com and let her know what's on your mind, and we will do our best to comply. Okay. All right. Well, I guess let me see. Supplements for building muscles that actually work and have proven studies. This is something I ask a lot. First of all, I'm a big fan of creatine. Creatine was really big, like in the late 90s, early 20th century, because we felt that it helped to build. It's not that it builds muscle. What it happens, voluminizes, if that's the word, is a word, voluminizes the cell. It actually keeps water in the cell. It blows the cell up, the muscle cell, that is. And eventually it does have a role in muscle synthesis. But what I'm really interested in it now is it has a positive effect on brain power and cognitive function, which we didn't know diddly squat about back in the 90s, early part of the century. So I'm really big on creatine. I'm not, I think the important thing for muscle building is to get your hormones checked, female or male. I am into hormone replacement. I will preface that by saying that I am definitely pro hormone because I'm anti-aging. Okay, does that mean everybody should be on hormone replacement? Absolutely not. It depends on what your goals are and your personal history. I do think, especially with women, there's three important things that you're going to get from hormonal therapy that you're not going to get on your own while you age is heart health, bone health, and brain health. Same thing for men, but it will also help build muscle. It helps with build muscle um, synthesis. So it's not about becoming a bodybuilder. I mean, I took it to a different level because that was my interest. You don't need to do that to get the effects of strength training, but muscle building is important. So I think creatine, along with checking your hormones to make sure that they are sufficient, because if you have no testosterone, you ain't going to build muscle, even if you have strong will. It's going to be very, very difficult. So you need to have your building blocks in order, so to speak. And that's important. And I do a lot of hormone replacement in both men and women. How's the heart shaped? Um, okay. Oh, BCAAs are good. Yeah, I'm sorry. I left that out, didn't I? Branching, I take a supplement. I usually train in the morning. I take a supplement called Reload, RELOAD. I think it's by MRM. Anyway, tastes pretty good. It's got BCAAs, L-glutamine, and beta-alanine. It's supposed to be post-workout, but I actually sip it during my workout. So it helps with muscle building. And L-glutamine is actually, we call that a non-essential, essential amino acid, meaning it's really not essential because your body makes it, but it doesn't make enough of it because usually it's for the gut. And your gut requires a big punch. But if you want more for muscle building, you got to add it. So yes, BCAAs, L-glutamine, very important. Beta-alanine are good, and the name of that product is Reload by MRM. You can get it at any sports supplement store. Um, okay. Now we're getting some good questions. I think I did everything. Protein powder. I'm not a real elitist on this. I just go. Um, I tell you, I've used every protein powder there is. Protein powder is pretty generic. First of all, you may make sure that you're not. I don't. I mean, I like whey protein. Whey protein is high in branched chain amino acids. Also, cottage cheese is very high in branched chain amino acids. Pea protein, rice protein. I'm not a vegan. It's not the same. You're not going to get nearly as big bang for the buck as far as for muscle building. Muscle building, you want whey protein, WHEY. And, you know, rice protein, pea protein, they're okay. Soy protein, I don't take soy at all. I don't think it's great for men. It's too controversial. It's been that way for even with women. It's somewhat controversial. Um, my question is, why take soy if you can take hormones? But a lot of people are really anti-hormones. They still think it's, and I want to drive this point home. They think, especially women, they think hormonal therapy, and most doctors think this. It's only when you are going into menopause and you got all these symptoms. It is very good for symptom relief, no question about it. But like I said, brain health, bone health, heart health. Not enough reason for me to take hormone replacement therapy. So these doctors that are telling these women to get off of it as soon as they can, they're just wrong. They're just wrong. And they're out of date. That's the last century, folks. So one of my jobs is to tell you what's current and what should be thrown out. And that should be thrown out. Okay. I think we did it, guys. I got through my cough. Sorry about this. Of all times, right? Okay. Well, listen, I guess I just wanted to make sure there's nothing new here. The golden years. I know. The golden years. I don't know what they call the golden years anymore. You know, every year is golden. It's what we do with it. Age is just a number. I don't really feel my age, although I've gone through some real hell the last year. But I'm thankful for what I have. I try to be thankful for what I've been given, including a wonderful relationship that I no longer have, unfortunately. But I've been gifted a lot, and I'm enjoying giving it back. So if I can reach as many people as I can through forums like this, there'll be some changes in my practice in the next few months, which you'll be hearing about as I make them. But this is not work for me. This is fun, because I get to communicate and educate. With that, I think I'm going to shut up. It's like, yeah, feel better. Thank you, guys. Happy holidays to everyone. Happy Hanukkah. Merry Christmas. Happy New Year. May your dreams come true. We probably won't do another one in January. I mean, in December, because next week I'll be at the American Academy of Anti-Aging Medicine meeting. They were just too close to Christmas. And no one wants to hear me during the holidays anyway. But I'll come up with some good programming for January. I wish you all happy holidays. May all your dreams and wishes come true. Stay healthy. Stay positive. Like I said, reclaim your power when you see these doctors. Don't feel like you have to just do what they tell you. Yeah, I mean, be nice, exercise grace, but it's your body. Whose body? I always end my talks with this: whose body is it? It's your body. So do the best with it. Thank you and good night. And I'll see you probably next year. Thank you, guys. And get my book if you haven't, and write me a review. Thanks.